Hello and welcome to Medical Dialogues. I am Dr. Bhumika. Let's look at today's top medical news. More job strain can lead to more sleep disturbances, researchers. In a recent study published in the American Journal of Industrial Medicine, middle-aged workers in the US who reported high job strain at the start of the study experienced significantly more sleep disturbances over an average follow-up of 9 years. The study analyzed data from 1721 workers with an average age of 51 years who participated in the midlife in the United States studies. Sleep disturbances were assessed with an established scale based on 4 sleep-related symptoms: trouble falling asleep, waking up during the night and having difficulty going back to sleep, waking up too early in the morning and being unable to get back to sleep, and feeling unrested during the day no matter how many hours of sleep. Can AI improve the success of IVF treatment? A new study found that during IVF, delivering the hormone injection when a greater proportion of follicles were sized between 13 to 18 mm was linked to high rates of mature eggs being retrieved and improved rates of babies being born. The findings are published in Nature Communications. Researchers used explainable AI techniques, a type of AI that allows humans to understand how it works, to analyze retrospective data. They explored which follicle sizes were associated with improved rates of retrieving mature eggs to result in babies being born. Their findings suggest that maximizing the proportion of intermediately sized follicles could optimize the process. In the retrospective study, the team used AI techniques on data from 19,082 patients aged between 18 to 49 years of age who had treatment in one of the 11 clinics between 2005 and 2023. They examined individual follicle size on days prior to and on the day of trigger administration. Climate change worsens HIV prevention and care, study finds. Researchers find that climate change and extreme weather events impact HIV prevention and care through numerous pathways, including increased HIV exposure, reduced testing, and worse health outcomes for people living with HIV, according to a review published in Current Opinions in Infectious Disease. Researchers analyzed 22 recent studies exploring HIV-related outcomes in the context of climate change and identified several links between extreme weather events and HIV prevention and care. Climate change-related extreme weather events such as drought and flooding were associated with poorer HIV prevention outcomes. Extreme weather events were also linked to increased practices that elevate HIV risk, such as transactional sex and condomless sex, as well as increases in new HIV infection. Research reveals intermittent fasting improves heart health and promotes weight loss and obesity. A team of scientists has shown that intermittent fasting is an effective method for losing weight and improves cardiovascular health in people with obesity problems. Their work, published in the journal Nature Medicine, reveals that eating the last meal before 5 p.m. and then not eating dinner at night is a safe and effective strategy for reducing subcutaneous abdominal fat, that is, the fat just under the skin. Researchers have investigated the effect of a 12-week intervention with 3 different fasting strategies. Early fasting, that is intake sale, approximately around 9 am to 5 pm, late fasting approximately around 2 pm to 10 pm, and self-selected fasting where people could select the time slot in which they want to eat and did so on average between 12 am and 8 pm. In this randomized controlled multi-center trial, a total of 197 people aged 30 to 60 years participated. Participants were randomly assigned to one of the 3 groups. Thank you for watching Medical Dialogue. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.